This is the alcohol use pyramid. It describes patterns of alcohol consumption in the general adult population of the United States. At the base of the pyramid are about 70% of the population, individuals who abstain from alcohol or drink at low risk levels. At the tip of the pyramid is about 4% of the population, individuals who have an alcohol use disorder. In the middle of the pyramid is about 25% of the population, individuals who drink above a moderate level but do not have an alcohol use disorder, considered risky drinking. And it's this 25% of the population where alcohol screening and brief intervention can have the greatest impact. From a public health perspective, it's the middle of the pyramid, the 25% of individuals who drink above a moderate level but do not have an alcohol use disorder, that accounts for the majority of the harm associated with alcohol in our society. The evidence for the effectiveness of screening and brief intervention for alcohol is strong. The United States Preventive Services Task Force issues recommendations for primary care healthcare settings. It gave alcohol screening and brief intervention a grade B, which means this service should be offered routinely to adults in primary care. Several other organizations in the United States also endorse routine screening and brief intervention for alcohol. Research shows that alcohol screening and brief intervention can reduce alcohol consumption by 25% in those who drink too much but do not have an alcohol use disorder. The United States Preventive Services Task Force issued an insufficient evidence statement regarding screening and brief intervention for drugs. Recent research published in the Journal of the American Medical Association found that screening and brief intervention for drug use was not effective at reducing days of use of marijuana, illicit, or prescription drugs. Researchers suggest that patients with drug use may require multiple or more intensive interventions to address drug use effectively. However, screening in primary care to assess the use of drugs still may be important in order to provide good quality health care. The United States Preventive Services Task Force issued an insufficient evidence statement around screening and brief intervention for adolescents. They concluded that there's not yet enough evidence to make a recommendation for or against routine screening. However, the American Academy of Pediatrics does recommend screening and brief intervention for alcohol, drugs, and tobacco. Adolescents may require a more intensive intervention or multiple interventions in order to effectively address substance use.